I'm doing well. Okay, looks like our guest got held up there. Where's Chris? We lost Chris somewhere. Chris Mahaffey. Hello, Chris. We're trying to start a press conference. Boy Scouts, aren't you guys supposed to be on time and stuff like that? Okay, all right. Well, again, welcome everybody to our press briefing with regard to what the state is doing to slow the spread of coronavirus in Nebraska. Happy Friday, everybody. As always, we want to remind people about our 6 rules to keep Nebraska healthy. Again, avoid unnecessary trips outside your home is rule number 1. Number 2, work in a socially distanced way. Keep 6 feet of distance between you and other people. Avoid, respect the 10-person rule. Avoid groups of more than 10 people. 3, shop, but only shop once a week, and shop by yourself. Don't take the entire family. Be efficient. Get in and get out. Number 4, help kids socially distance by keeping them at home to play, and avoid group sports and those playgrounds. Also, help our seniors. Rule number 5, go run errands for them so they can stay home. Go shop for them, but don't go visit them in a long-term care facility, and we're going to talk a little bit more about that a little bit later here. And then number 6 is exercise once a day, or at least once a day, but do it at home or in a socially distanced way that's going to be appropriate. As always, I want to remind people about Test Nebraska. Please sign up for testnebraska.com. This is one of the ways that we're getting an assessment of what's going on in the state. We're using it to schedule people to be able to get tested. So please sign up for testnebraska.com. We are testing today in Omaha and Lincoln, Norfolk and Lexington. So we've got teams out there, 4 mobile teams right now that are out there testing people, so please sign up. Again, there's wait lists on these things, so sometimes you may not be able to get a test slot right away, but please keep trying back. You'll receive emails on it and so forth about it. If your symptoms change, please update the assessment there as well. It's all keyed back to that email address you put in, so again, please continue to stay in touch with the testnebraska.com. So and then finally hospital data. So again, the whole reason we put all these restrictions in place is to make sure we preserve our healthcare system. So that has been the guiding principle we have had in place since we started managing this emergency over 2 months ago. And our hospital capacity has stayed very stable throughout the course of this. We've been able to manage it even in areas where we've had hotspots. Right now, we are looking at a 47% capacity for hospital beds, 43% for 42% for ICU beds, and 75% for ventilators. And if you've been following along, you see these numbers have stayed stable as we've been announcing them, throughout the course of these past few days. Now, we have a number of efforts around combating the virus. We've talked a lot about testing. Yesterday, we talked about contact tracing. And in fact, in contact tracing, we started bringing on one of our private companies, started making phone calls today. We were doing training with them this week. PRC out of Omaha is starting to do contact tracing calls for us today. So we're continuing to augment the contact tracing. We've talked about, getting PPE and getting that distributed. We're feeling good about where we are with regard to that. We've got quarantine space available for folks to be able to isolate, quarantine, convalesce, and so forth. We've got hotel rooms available for our first responders and our healthcare workers. So again, making that space available is part of how we're doing this. And then we also are making sure that we continue to focus on at-risk populations. So we've talked about, for example, some of the things we're doing with regard to food processing facilities and so forth. One of the other at-risk populations we have is long-term care facilities. So we continue to work with our long-term care facilities here in the state to be able to provide them guidance. In fact, we've had the ICAP program here in Nebraska for about 4.5 years, which is a grant that's funded by the CDC. It's actually then comes to the state, and we've actually been working with University UNMC and Nebraska Medicine to be able to have a program that goes out and has guidelines, training, visits facilities about how they can do infection control. Obviously, during a pandemic, that's a really important thing. So there's a number of steps that we are doing to work with facilities to be able to prevent that infection control, including long-term care facilities. And so we are going to be working with our long-term care facilities to ask them about how they're going to continue to manage this through the end of the year. As we've talked about, this is something where there's no immunity for this virus. We can't stop it from coming. We can only slow the spread. We know that there's no vaccine for it right now. And it was published in the paper this week with regard to Michael Ryan at the WHO. There's no guarantee there ever will be a vaccine. So we've got to continue to manage this. So we're going to be reaching out to long-term care facilities to work with them on a plan. What is their plan going to be for how they're going to continue to manage this through the rest of the year to be able to make sure they're keeping the health and safety of the residents at the forefront, but not just with regard to coronavirus, with regard to other issues like mental health, but also on how are we going to be able to manage family interaction with your residents. So we're going to be working on a template with the industry, asking the industry to come back and share their plans with us. And Becky Wiesel from our Department of Health and Human Services is going to come and talk a little bit more about our plans with regard to long-term care facilities and what that will look like. So Becky, I'm going to ask you to come up. Thanks. Just don't get those two things confused.
I won't. Thank you. Thank you, Governor. I'd like to share about the role of DHHS related to long-term care facilities during the pandemic. Care for residents in long-term care facilities is a top priority for DHHS. We've been working closely with long-term care facilities, local health departments, and other partners so they can continue to provide quality care for residents in their communities and maintain a safe environment during the COVID-19 pandemic. Our role is as a resource with the goal of mitigating the spread of COVID-19. DHHS has developed a long-term care COVID-19 response planning tool. This is a tool to assist nursing homes and assisted living facilities in developing a comprehensive COVID-19 response plan. The tool includes key areas that facilities should consider in their planning, including rapid identification and management of ill residents, considerations for visitors, supplies and resources, infection control and disinfection protocols, and surge capacity for staffing. It includes resources for additional information, such as how to request personal protective equipment from the state. It provides mental health resources for residents and staff. And it includes a number of other resources from the Centers for Disease Control and Prevention. The tool is based on requirements and guidance of Centers for Medicare and Medicaid Services, Centers for Disease Control and Prevention, and the state of Nebraska. The tool can be used to self-assess strengths and weaknesses of current preparedness efforts. The planning tool is important for long-term care facilities. It can help facilities to plan and prepare for managing COVID-19 in the coming weeks and months. It provides guidance and resources for circumstances that may not have occurred in every facility. And most importantly, it aids in the overall effort to combat COVID-19 in the state of Nebraska. Considerations for facilities as they develop their COVID-19 response plans. Use the tool as a guide to consider key factors. The plan is a supplement to specifically address COVID-19 and can become a part of the facility's emergency preparedness plan that is required by state and federal regulations. Or it can be a separate plan to specifically address COVID-19. Every facility is expected to complete a plan. Once your plan is completed, facilities should send an email notification with the facility's name and license number to the DHHS Healthcare Facilities mailbox at dhhs.healthcarefacilities@nebraska.gov. Facilities should also keep a copy of the plan with their emergency preparedness plan. We are collaborating with associations. We're working with the associations to facilitate feedback on the planning tool, and the tool will be sent to all long-term care facilities in Nebraska in the near future. And we share a common goal. We all want to protect our most vulnerable residents, many of whom reside in long-term care facilities. We hope this tool will assist facilities in their efforts to manage COVID-19 and help maintain quality care and safe environments for residents and staff.
Great, thank you, Becky. Is that it?
Yes.
Okay, don't go too far. I know we've got some other questions. We're going to have other questions on this, so don't go too far away. All right. So thank you very much, Becky. And another area that we know has been impacted by this pandemic has been our food banks. We've had the food banks here in the past. My understanding is that the food banks are maybe using $1 million a month to be able to help folks who are food insecure right now. And that is a lot more than what they were doing in the past, I think maybe even up to 10 times. And so one of the organizations that has stepped up to help them is the Boy Scouts. So we've got Chris Mahaffey here to be able to talk about what the Boy Scouts are doing to be able to help our food bank meet the needs of our families that are food insecure in Nebraska. So Chris, can you come up and talk a little bit about that program?
Happy to, Governor Ricketts. Thank you for the opportunity to be here today. And thank you for your support and for our government official support for Scouting for Food. On behalf of Brian Barks from the Food Bank from the Heartland, we're proud to present Tyson Scouting for Food this Saturday, starting at 8 a.m. The Mid-America Council, in a very short time frame, which covers northeast Nebraska, all of western Iowa and Union County, South Dakota, has put together the Scouting for Food drive in this particular time frame. This is a very difficult time for us to ask families and scouts to be out, but with the governor's help and our state officials' help, we think we've got a really good plan in place. And there's really some things that our community can do to help make sure that we keep everybody safe and help the food banks during this unprecedented time of need. Brian has shared with me that their need has gone up more than 40% on average, and that the average donations that his food bank has received have gone down dramatically as well. So Scouting for Food is desperately needed. On average, when we run this service project as an organization, more than 300,000 meals are collected on an annual basis. That would go a really long way right now. So here are some things that our local community can do to help tomorrow during Scouting for Food. First of all, our scouts last weekend fanned out and put all these sticky notes out in the community. And there should be yard signs in front of neighborhoods where scouts canvassed for Scouting for Food. In those neighborhoods, if you'll do a couple things for us. One, take your food items, put them in a plastic grocery sack, one knot on the top, and put those at the end of your driveway. That will help with social distancing, which is the first thing we were asked to do with Scouting for Food. Number two, if you don't feel comfortable leaving food items out by 8 a.m. tomorrow morning, we'd ask that you go to one of 5 area Hy-Vee supermarkets in Douglas County, or to the local food banks that are listed on our website, and that's mac-bsa.org, for you to be able to find the list of resources for the food banks and for the Hy-Vees which are participating. Find the big Warner truck in the parking lot and get in line to drop off. This is a no-contact drop-off. So you'll drive up, pop your trunk, open the hatch, tell us the food is in the back of the truck. Our scouts and volunteers will unload that truck using social distancing and allow you to be able to move on without any contact with our volunteers or our scouts. Number 3, if you don't feel comfortable doing that, we'd ask that you consider going to the Food Bank for the Heartland's website, and right on the front page, there's a Donate Now button. Brian is, like the governor said, is having to spend an enormous amount of dollars to make sure that they're meeting the needs on a monthly basis, and your monetary donations will go a long way. And I'll also ask, while you're there, find the volunteer button and maybe sign up to help pack meals for Food Bank for the Heartland at some point in the future. We want to do all this and stay safe, so we've asked our scouting families to do a couple of things as well. Number 1, go as a family unit to help with social distancing. So you'll have a parent and a scout go together and canvass neighborhoods. Number two, instead of congregating back together and counting all the food items, we're asking them just to take them to the local food pantry, which are all supported by the Food Bank for the Heartland, or back to the Warner truck at one of those 5 locations in Douglas County, and make sure that they keep social distancing and drop those items off. And then we're also asking them to consider wearing a mask and to keep good hand sanitizing practices during their time tomorrow collecting food. We know that we can count on Nebraskans to help in this time of need, and our scouts are looking forward to upholding the third point of the scout law, which is a scout is helpful. And as you see them out and about tomorrow, please be mindful, because it looks like it's going to rain. Provide a cheerful smile and a word of encouragement as they work to help do so much good in our community. Thanks again for having us here, Governor.
Chris, did you want to just say a little bit about what sorts of food items, if people just wanted to put them out tomorrow, what they should be putting out?
Sure. So the food items tomorrow are all non-perishable, and think about rain tomorrow as well. So if you would put canned food items out, if you think about that number 5 or 6 per bag, that way bags aren't breaking, which would help keep contact down on those hard surfaces. Consider that as well. But macaroni is always a big favorite. Peanut butter and jelly are always needed. Canned meats are always important during the food bank and the Scouting for Food drive, so keep those things in mind. There's a more comprehensive list on the food bank's website as well.
Thank you very much, Chris. Appreciate all the work the Mid-America Council does, and of course, Boy Scouts, just a wonderful program that does so much to teach our youth about all the basic values and leadership and all the other things that go along with becoming a great person in our society. So thank you very much for all your work. Great lesson there. All right. A couple of things I want to hit upon. One, that our unemployment system was actually ranked as one of the 5 states that was able to be able to perform on a survey that was put out there by an independent group that tested reliability, mobility, how to work with mobile devices, and accessibility. If you looked at all those 3 tests, Nebraska passed all 3. We were one of 5 states that passed all 3 of those tests. So we're very pleased about that result. So I want to say congratulations to John Albin and to, who's our labor commissioner, as well as to Ed Toner, our OCIO, with regard to that. That's fantastic that Nebraska ranks so well with regard to that technology and be able to stay up even during the a large amount of visits we've had to our website. Also, you may recall that we were going to do a National Guard flyover in recognition of our healthcare workers and everybody else who is working to prevent the spread of coronavirus here in Nebraska and working to help keep people healthy and safe. Because of the weather, we were forced to cancel that flyover, but that has been rescheduled for May 18th. So everybody out there can just check the Nebraska National Guard website for the scheduled times for that, but it's going to be very similar to what we were talking about before, and hopefully the weather cooperates this time and we can get it done. Again, just next week, we will be continuing to do English language briefings at 2 o'clock Central Time, Spanish language briefings at 5 p.m. Central Time on Tuesday and Thursday, and then we'll be on NET again, 8:30 to 9:30 Thursday night next week, speaking of Nebraska. So same sort of schedule we've had this week, we'll continue to have for next week. So please join us. All right, so let's get into some of the questions we got here. John Madden, KMTV. Governor, do you plan on extending the mandate to defer eviction notices after 5/31? If so, why or why not? Any message for landlords about rent concerns with tenants? We will be looking at all the executive orders that we have put out there that are set to expire at the end of May. We're doing that evaluation now, so I would say just stay tuned with regard to those executive orders. Gavin Higgins, KCNI. In the beginning, information from health departments was specific and helpful to know possible places of community spread, and the public was well informed. Now health departments are only saying the county with no other information. Can the governor comment on the change and lack of information coming from the departments? Again, what we have asked is that because some information was incorrect, we've asked local health departments to make sure that they confirm things such as place of employment if they are going to put that information out there. So we're just asking to make sure that whatever information is being deployed is accurate. So that is kind of our guidance out there. Jeff Van Sant, there are more than 60 cases of COVID at a long-term care facility in Elkhorn. What role the state, if any, is playing in assessing the issue? Again, what we do is kind of what Becky was talking about. Becky, you want to come up and talk about just in general what we do for facilities with regard to this? That'd be probably a good place to start. See, I told you not to go too far.
I won't be speaking about a specific facility today, but here's what I can tell you. When a COVID-19 positive resident or staff member is reported in a long-term care facility, the local health department investigates to identify possible exposures. Our team works closely with the local health department to conduct case investigations and contact tracing to identify anyone who could have been exposed to the positive resident or staff member. Additional testing is conducted at the facility. Any facility that has a resident or staff member test positive for COVID-19, an infection preventionist from Nebraska Medicine's Infection Control Assessment and Promotion Program, or ICAP, will work with them on additional precautions and infection control protocols needed to maintain safety, ensure care of residents, and mitigate the spread of the virus. Additionally, our ICAP team does do proactive visits on site and provides guidance to help facilities prevent infection before the facility has an issue.
Thank you, Becky. The ARP has called on your administration to be more transparent, providing numbers of COVID cases in long-term care facilities. Actually, we provide that upon request every day. Actually, pretty much I think we've been doing it every day this week at least. Is there anything more being done to do this? Again, we provide those out there. Some say there are HIPAA issues involved in this case. Again, this also goes back to our general policy that if the local public health department wants to release that company-specific information, they need to confirm employment if they're going to talk about something like that. And again, our policy with regard to long-term care facilities is, we talked about already, is when we have a case, right, this gets treated just like any contact tracing. The facility is made aware. We do the contact tracing, find out who that person, work with that facility on who may have been exposed and what the steps are, kind of what Becky was talking about, isolating people and so forth. If the families can find out from the facility, if you are looking at placing somebody there, call the facility and ask. So the information is out there for regard to specific facilities, and the families are made aware of that when their loved one is tested positive. In your opinion, can or should be done to assure families the safety of their elderly relatives in long-term health care facilities? And again, this is one of the reasons why we've asked families not to visit the facilities, because we are trying to keep those folks away from the rest of the members of the public. We're working with the staff. We're following CDC guidelines. So the state, in fact, actually is one of this ICAP program is probably one of the ones, it's probably almost a unique one in the country with regard to what we've been doing with regard to infection control for 4.5 years now, working with these facilities. And we continue to work with these facilities. I know that, Shelley Sweethome, for example, has visited at least 24 of these facilities, working on them specifically about things they can do to improve how they're doing their donning and doffing of PPE, isolation, all that sort of thing. So the state continues to work with these facilities to make sure that they're doing a good job. And as we talked about today, we're going to be working with the industry to have every facility submit to us a plan for how they're going to continue to manage the virus, in this emergency. Bill Shammer, KOLN. What does the future look like for health clubs and theaters? Any thought of adjusting the 10-person rule to do something based on square footage? So again, right now, healthcare clubs can be open. They're limited to the 10-person rule, just like every other business. And you got to keep the equipment 6 feet apart and sanitize it between use and all that sort of stuff, kind of common sense stuff. So health clubs can be open right now. Theaters, we are actually one of the few businesses we've actually specifically closed, and so those are not open right now. But with regard to future loosening of those types of restrictions, we will be looking at those as we get, through May and looking at into June. We just loosened restrictions starting May 4th. We've only had now about 11 days. As I mentioned yesterday, we want to have about at least 14 days to be able to take a look and see what's happening with regard to, say, our hospitalization and so forth, to make sure that things are still remaining stable. So we'll be looking at those issues and loosening more restrictions as we go forward in the future. So I'd say just stay tuned with regard to specifically those things. We will be making announcements as we loosen further restrictions. David Kelly, KTCH. Today, our local four-county health department is reporting 64 positive cases out of 574 tests. However, there's no indication as to whether any of these positive tests are still active cases. So again, just on that case, generally when a case is reported, that's when we receive that test back that is positive. So that person has tested positive within just the last few days. So I think it's safe to assume that person is an active, has still got the virus and is being asked to isolate at home. Or if any of these have recovered. So again, if somebody had just been tested positive, they're not likely to have been recovered yet because, again, that test result just came back. So again, typically, again, we see people, they get tested when they are symptomatic. So if they're still symptomatic and they're getting tested, they'll probably still have the virus by the time the test result gets reported back as positive, so they will not have recovered. Now, some of our public health departments are reporting recovery. So I know, for example, Douglas County is doing that. But it is on a public health department basis. And there's no information on the number of hospitalizations, if any. Why is this information being withheld from the public? Other states around the nation are reporting recoveries and hospitalizations. Why not Nebraska? So again, this is just about what the local health departments have been doing with regard to collecting data, prioritizing things like getting people who have tested positive to isolate, calling them first. That's one of the reasons why we're ramping up our contact tracing to be able to do that. We are looking at collecting additional data. So for example, one of the things that we're asking all the public health departments to do as a priority is collect race and ethnicity. So for example, Douglas County and Lincoln Lancaster are collecting that data. We're working with the other public health departments to collect that by the end of the month. So that's an example of us looking to collect additional information. And we've received the feedback about hospitalizations. And again, nobody's withholding any information. We've got that data. So that's one that we may look for a way to create a public dashboard about that. We do have the hospitalization total, like that I always announce here now. It's on a public dashboard as well with regard to the percentage of hospital beds available, ICU beds available, and ventilators. However, we can also start looking at other public dashboards with regard to that as well. And again, recoveries, again, great thing to track. Don't disagree. Again, it's really the public health departments who manage this at the local level. So as they have the bandwidth to be able to start collecting more of this data, I'm sure we'll start collecting more of this data. But as I said, some health departments are, like Douglas County. Chris Brown, Bloomberg. The current rate of positive corona tests in Nebraska is just over 16%, putting it in the top 5 of the country for the highest positive rates. Do state officials have an explanation for the high rate? What implications does this rate have for the state's reopening plans? Do you expect the Test Nebraska results to start pushing that number down? So kind of unpack that from the beginning. So the rate of positivity is something that we use when we're looking for indications of where we might have a future hotspot popping up. Use the example of Lexington. So when we got to a 30% positive test rate there, we provided additional resources in the way of more testing, more contact tracing. We worked with the hospital to move people out of the hospital to make sure there was room to accommodate anybody new that was coming in. Similar to the kind of things, for example, we've done in Grand Island and other places around the state. Again, I would expect that if you look at where are a lot of our cases coming from, and you're looking at the food processing industry, that is one of the reasons, again, very difficult place to be able to socially isolate at work and so forth. So that's probably driving. I think there was a story in the Omaha World Herald yesterday about Tyson did some testing at their Madison facility, had like a 14.5% positive rate there. So I think that if you're looking at the overall state rate, some of it's probably tied back to some of these places where it's difficult to be able to socially distance and where we have concentrations of people. And what does that implication have for our opening plans? Again, when we look at how we're loosening some of these restrictions, we're doing it based upon how is the hospital system being impacted? How are we able to manage that? And as the numbers I've given over the last several days with regard to those rates, our hospital system is stable. It's been stable the entire time we've been able to manage this. Even in places where we've been heavily impacted, like in Grand Island, we've been able to manage that hospital system. The folks at CHI St. Francis did a wonderful job of working very, very hard, and all the hospitals around the state really were great partners in being able to cooperate and move patients and so forth. So again, that's how we manage it. So the overall percent positive rate doesn't really play into how we're loosening restrictions because we're focused on what we were told, over 2 months ago. It's about making sure you preserve your healthcare system. Nobody said anything over 2 months ago about what your percent rate positive should be or anything like that. That's not something that we've been using as part of what we've been focusing on with regard to how we manage this emergency. And do you expect Test Nebraska results to start pushing down that number? And again, as we test people who are less symptomatic or asymptomatic, healthcare workers, food processors, first responders who are not somebody who has been specifically exposed, then yes, I would expect that that rate will start coming down because, and we've already seen this with the Test Nebraska results, that we do see a lower rate of percent testing positive in those cases. Don Walton, Lincoln Journal-Star, has your gradual loosening of restrictions matched up with UNMC counseling? So yeah, so this goes back to, again, when we sat down with UNMC over 2 months ago to start talking about how you plan for this, what restrictions you put in place, and how you loosen those. What they talked about is doing this loosening gradually over time. They said you don't want to put the restrictions in too early because then people will get tired and they won't follow your restrictions. But what you want to, and when you start loosening them, you don't want to unloosen them all at once so that people go back to mixing in large groups together. Again, what we talked about over 2 months ago was the key for the virus spreading is large groups of people who get together. So you avoid large groups of people getting together. And that's why, for example, we've got the 10-person rule in place right now. We're not going to just take that off in June. Or if things stay stable, we'll look to loosen that up, but it's not going away. So the steps we have taken to loosen the restrictions this month have absolutely been aligned with that whole strategy of taking it a step at a time and gradually loosening restrictions. So it has been absolutely in line with the UNMC recommendations, and again, focused all around what we talked about, which was preserving the healthcare system. That is what we talked about over 2 months ago with UNMC. They said, again, you can't stop this virus from coming. Nobody's got any immunity. What you want to do is slow it out, spread it down so that that peak gets flattened down so that you preserve your healthcare system. That is what we've done here in Nebraska, and it's been tremendously successful. All the restrictions we've put in place, the sacrifices people have made, have worked. We've preserved our healthcare system, and now we're going to gradually loosen things back up, still with the mind of keeping that hospital system preserved. Mona Weatherly, Custer County Chief. We've heard, and I've used, the words guidelines, protocols, restrictions, DHMs, directed health measures, and so many terms describe the rules, she put that in quotation marks, for our lives right now. I've heard some people say, what are you going to do if they don't follow? So, okay, could the governor provide some clarification about what is law and what is guideline? So, yeah, specifically, when we write a DHM, that is law. So if you go out and read a DHM, a directed health measure that we put out, that is law. And it's a misdemeanor criminal violation to violate it. So if you're breaking that DHM, police can come and cite you for that. So that is law. To supplement the DHM, we do write guidelines. And these are things that we really do expect Nebraskans to follow. And I'm going to just give you an example. One of the DHMs, for example, is the 10-person rule. When we released the guidelines, for restaurants, we put some things that were in the DHM, but some things we put in guidelines. One of the things we put in guidelines was staff wearing masks. So that is a guideline, but we're expecting people to follow that. What we didn't want is that to actually be something where if a staff member just forgot their mask, took it off accidentally, and somehow got a misdemeanor for forgetting to wear their mask in a restaurant, we didn't want that to be a criminal penalty just for something like that. But there's other places where we're saying, well, this is really, really important where you have to wear your mask. So we have made it a criminal penalty, like for things like when you're in close contact with salons, at salons or tattoo parlors or what have you. So there are specific cases like that. Now, we can always go back and review those rules, so we may go back and review those things, but if you want to know what is actually law, read the DHM. That is what is actually law. For example, if an organization holds a public event and 30 people show up, even if they follow social distancing, are they breaking law? And again, we're at the 10% rule right now in May, so yes, that is breaking the law. Mark Baumert, KSNB. What age groups or groups constitute youth sports? And I'm just going to add on, does youth sports include Legion Baseball? So we're including youth sports, anybody up through high school. And again, with Legion Ball, as long as you haven't started going to college, and you may have technically graduated high school, maybe you haven't had your graduation ceremony yet, but again, we're considering youth as people who are still in high school that have not gone to college. Tara Campbell, WWT. How are workers supposed to make informed decisions on how to stay safe if there's no guarantee they will be notified by their employer or the state about an outbreak in the workplace? So again, what we do with contact tracing is if somebody tests positive, we reach out and get all their contacts. So we're talking to that person now about who they work with, and if they tell us who they work with, then we will contact those people. If they give us permission, we can also contact the employer to get their contact information and follow up. So that's how people will find out, is that we do our contact tracing work to find out all the close contacts of that person to be able to reach out and tell that person. That's what the contact tracing does. In Heartland Worker Center in South Omaha is concerned about not being a requirement to report cases of COVID at individual plants. This organization has asked if you would meet with a group of meatpacking plant workers to hear why it's important they are guaranteed to be told if the outbreak occurs in the workplace. Will you consider meeting with them? We already actually have a phone call set up next week for workers. Michelle Bandur, KETV. Since your news conference Thursday, we've learned that 68 people are positive for COVID-19 at a care facility in Elkhorn. Do you feel this facility should be closed and evacuated? What direction are you prepared as government and state agencies about how to protect residents and workers at that facility? And Taylor, we had a question yesterday from Michelle as well with regard to investigations. She wanted to know what the investigation process is. So, Becky, can I ask you to just come up and again, just talk a little about how, what happens when we have outbreaks at facilities and investigations and that sort of thing?
We do receive complaints, and those each are prioritized when they're received. And we do have surveyors who go out on behalf of the Centers for Medicare and Medicaid Services and do investigations of those complaints. In addition to what I had shared earlier about how we work with the local health departments and the ICAP to go out and provide resources and help facilities with their infection control practices.
And just, Becky, what's the policy with regard to doing those investigations? You don't talk about those investigations while they're ongoing, is that right?
That is correct. We're not able to confirm whether or not there are investigations at this time. If there is an investigation into a long-term care facility, and if we end up taking action against that facility based on the findings, once that information, once the process is completed, that information would be available to the public.
Thank you, Becky. And then specifically when it comes to looking at evacuating different facilities, what we'll do is we will evacuate a long-term care facility if we feel like the staff is no longer able to provide care to the residents. And that really is a staffing issue with regard to, you know, the estimate to make sure that there's enough workers there to continue to provide that care. So that's the condition that somebody would be evacuated from that. So did we catch everything else on that? Yeah, so again, it would be closed and evacuated if we felt like the staffing was not appropriate to be able to provide that care. Sarah Klinger, KETV. Governor, what is your reaction to Nebraska's death rate of residents in nursing homes is much higher than the national average? In fact, almost double, according to a New York Times report that said long-term care facilities make up 35% of the nation's death rate, while Nebraska is about 70%. How families are supposed to have faith in Nebraska's long-term care facilities. And this is one of the reasons why, again, we're working with the industry with regard to the plans, because the folks in our long-term care facilities are at higher risk because they're generally older and they have those, in general, may have underlying healthcare conditions, those comorbidities we talk about. And so that's what puts them at higher risk. And this is not, Nebraska is not alone in this. There are other states that are like that as well. So I actually, we looked at that New York Times article. That, interestingly enough, if you look at the Times article that was referencing this, it said Nebraska's rate was 2%. So that article is probably a little bit dated or had inaccurate information in it. But in general, so it's certainly not something that is unique to Nebraska with regard to, this is going on in other states as well. As I've talked to some of my colleagues, I think Rhode Island, Michigan, Wisconsin, other states like that have also been impacted like this. And again, it gets back to, you know, these folks are particularly vulnerable to the coronavirus, and that's why we have to work with the facilities to make sure we keep people protected. I know family members are unhappy because they can't visit, But there's a reason for that right now, that we've got to, again, have a plan in place to be able to manage those family visits so that we're not endangering the residents. It's why we, again, place a lot of priority with regard to the ICAP training program, the visits we've done with Shelley Sweet Home and Nebraska Medicine, and all the other things we're doing to provide PPE, staffing, and so forth to those facilities. Stu Pospisil, Omaha World Herald. The Nebraska Shrine Bowl and 2 other all-star football games have been pushed back their dates from June to July. How will social distancing guidelines have to change for those games to be played? And again, Stu, I'd say, hey, we're just not even 2 weeks into looking at what we're doing since we've loosened some of the guidelines. We will be having more guidelines in the future. We'll make more determinations about what's going to happen in June or July as we get a little bit more data through May to ensure that everything is continuing to remain stable. And we're going to, again, take this a step at a time. But I think that everybody kind of gets the point by now, though, that large public events is where the virus spreads. And so if these events are going to go forward, they will not look like they did last year. There will have to be social distancing in place so that we further prevent the spread of the virus. So I would say just stay tuned. I think, for example, we talked about the youth baseball guidelines and just having families watch. Those are the kind of things that we're probably going to have to do. But stay tuned. We'll have more guidance on that. Andrew Saki, how soon will the Department of Corrections release the lethal injection documents as prescribed by the Nebraska Supreme Court ruling? Okay, this is not a coronavirus question, Andrew. Obviously, we just got the ruling from the Nebraska Supreme Court. We will follow the Nebraska Supreme Court rulings. I don't have a timeline for you with regard to the release of those documents. What is your concerns about carrying out future execution because of the unanimous court ruling? Again, we're going to follow the court ruling and continue to look for ways to be able to carry out the executions. All right, I've gotten through all my questions. Taylor, anything texted in?
Yes. Charlie Brogan wanted to ask Chris, what cities is the food drive being done in? Because he doesn't want people sending out food in cities where the food drive isn't happening.
All right, so Charlie Brogan wants to know what cities food drive is happening in because he doesn't want people sending out food in cities where it's not happening. So you can come talk about that, Chris?
I can. Thanks, Charlie, for the question. This is for the Mid-America Council, which covers northeast Nebraska, so Douglas County, the northern half of Sarpy County, in a gentle sweep out to Norfolk and Columbus, all the way to the South Dakota state line, and then western Iowa, all the counties, except for Dakota and Woodbury, which have directive health measures that prevent them from doing that right now. There are 2 other councils in the state of Nebraska, Cornhusker Council, headquartered here in Lincoln, and the Overland Trails Council, headquartered in Grand Island. And the 3 of us are working on some plans for a second food drive, since we know food insecurity is not going away anytime soon during this pandemic. And we're going to look at doing that during September. So hope that answers the
So if
question.
you're in a city in any of those counties, you're participating?
Correct. That's right. And there's more information on the MAC website.
So more information on the MAC website, you said it was mac-bsa.org. And again, so if you're one of those cities in the area that Chris described, it's a city that's participating.
And then finally, Danielle from NTV says with Memorial Day weekend coming up, people want to travel. What do you recommend for people to do?
Danielle, NTV, says Memorial Day weekend's coming up. People want to travel. What do you recommend people do? Actually, just kind of what we said at the beginning of the month, I'd prefer that people still look at staying close to home, celebrate just with your household, but avoid anything that has more than 10, any celebration with more than 10 people. Again, we really prefer people just kind of stay close to home here in the month of May. If you're going to travel, again, make sure that you're being careful with regard to where you're going. There are places where we still have high, community spread, places like New York and New Jersey and so forth. So I would avoid places like that at all costs. Is that it? Great. All right. So folks in the audience here, who wants to go first? Martha.
I have a question or a couple questions for Becky.
Becky, would you come up, please? Martha's got questions, and just a reminder again, please repeat Martha's question.
Okay. So the governor talked about the people who are the residents of nursing homes and assisted living facilities being especially vulnerable, but Nebraska does have quite a few facilities that have been affected, And so I'm wondering if you think that these facilities were properly prepared for this pandemic and were doing the right things before to prevent outbreaks.
So Martha's question is whether or not facilities in Nebraska were doing everything that they could to prevent spread of COVID. Were they prepared prior to the pandemic? Is that an accurate reflection, Martha? Nursing homes are regulated by the state as well as by the Centers for Medicaid and Medicare and Medicaid Services. And there are guidelines for requiring an emergency preparedness plan. And those requirements have been in place for several years now. And so facilities have been preparing for emergency situations. Not sure that any of us imagined the magnitude of something like COVID-19, but I do believe that facilities had put forth efforts to deal with emergency situations. And then, of course, our teams go in and provide assistance when we get requests from facilities. So the ICAP team as well as folks from the department.
Another question related to that, the AARP earlier called for more testing in long-term care facilities so that if one person, a resident or a staff member, tested positive, that you would be able to test the rest of the staff and residents. And is that something that you think would be a good idea, would be helpful to be doing? At that time, it was not possible.
Right. Martha's question is that AARP had made some indication that more testing should be done in nursing homes and long-term care facilities, and whether or not I think that's a good idea. In addition to what I had shared before, we do test anyone, both staff and residents in these facilities, if they are identified with symptoms. Currently, we're prioritizing testing to those who have symptoms. We typically would not test individuals without symptoms, as they could test negative one day and then contact the virus in the following days. But this is taken on a case-by-case basis and determined through information gathered in the case investigations and contact tracing. Each facility is different, and the exposure and risk situation at each facility is different. So we rely on those case investigations and contact tracing to help understand the varying levels of risk to determine those who are at highest risk and need to be tested. In addition, the Centers for Disease Control and Prevention currently recommends testing residents of long-term care facilities who have symptoms of COVID-19. And at this time, DHHS is following CDC guidance.
But the state, through Test Nebraska, is testing healthcare workers whether they have symptoms or not. And so in this very vulnerable population, why just restrict it to those with symptoms?
I'm wondering if maybe Dr. Antone could speak to that question.
Sure. So why not just test every long-term care resident? And obviously we have discussions about this all the time. And as the governor said multiple times, and Becky's mentioned today, a test just tells you whether you're positive or negative at that point in time. So by testing all long-term care residents on a daily, that would have to be done on a daily basis, every day. So it's better to test according to the CDC guidelines or according to symptoms. And then, as Becky mentioned, and the governor always mentions, then we have the local public health departments do their contact investigations to see who might have been high risk for that exposure. And you test according to those guidelines too. So by testing all long-term care residents or testing every citizen in Nebraska on a daily basis is just a point-in-time event. So at this time, it would be fairly useless to do that. So, but it's something we have discussions on every day. And Obviously, you know, as a doctor, I know how precious life is, and we don't want any deaths. You know, whenever you have a death, it's a tragedy. But, and then when the governor got up to ask that question about why do we have a high percentage of long-term care residents that, in our state that are dying? From a doctor's standpoint and from an ex-surgeon standpoint, I know we have such things as what we call risk calculators. And you can calculate a patient's risks of going into surgery. And so by my take on that answer would be, Nebraska's doing well, even though every life is precious, every death is a tragedy, that having a higher percentage of high-risk patients dying is probably a good statistic for the state, which means the lower-risk patients are not dying. And that's what you want to prevent. Not that we don't want anybody to die. And believe me, and Becky mentioned this too, that we have training webinars 3 times a week with our ICAP teams that have been ongoing since the beginning of the outbreak. So every facility has been getting trained. We have a training team. We have these ICAP teams. And even like the governor mentions all the time, we have Shelley Sweetholm's team go in and do actual training on site. And so we have been proactive as far as the long-term care facilities are concerned. Lee?
To the point of, you will test all medical worker, or frontline workers, however you want to reference it. What side is right then, in that you don't want to test everyone, but you're also testing all medical workers at the same time? It seems almost counterintuitive to not have one but have the other.
The question is why do we want to test healthcare workers without symptoms, or maybe, you know, if they're high risk, not test everybody or all long-term care facility patients? And that is because healthcare workers, we need to preserve the healthcare system.
Sure,
We
I
need.
understand that, but the point in time seems to be the point of emphasis, right? So
Yes.
So are you testing healthcare workers every day up until they would as well? Because if that point in time is the emphasis, wouldn't it seem?
Only if they had a reason to be tested. So we're not just randomly testing healthcare workers. Yes.
You said the state's not identifying individual nursing homes because you don't want to single out businesses if there might be extenuating circumstances. Why not say what the circumstances are and end this kind of guessing game? Because if the families are being notified and the public health districts are being notified, the information is sort of seeping out there, but in a disorganized fashion.
Yeah, so the question was, why not have the state just correlate all this stuff together and, you know, put out the information with regard to long-term care facilities? I've said in the past, hey, we don't, again, there's sometimes extenuating circumstances around some of these things. And again, specifically, Becky talked about when we're doing an investigation around a complaint, we don't make that public until the actual, you know, entire investigation is done. So I'm going to continue to stay with the policy that, hey, if the local public health department wants to make that decision, that is their decision to make. But again, on things like verifying employment and so forth, they've got to make sure that their data is accurate with regard to that. And again, families who need to know are being made aware. So the people who need to know about this because their loved one is in that facility are getting the right information. And if there's a complaint filed, we'll do the investigation like Becky outlined, and then that will be made public when at the end of that investigation.
We just have for a final question.
One last question? Yeah, Martha.
When you say families who need to know are being told, does that mean just the families of the person, the family of the resident who has tested positive, or does that mean the families of other residents who are in the same facility?
Yeah.
Does it mean families who are looking at facilities as a place to put somebody?
So the latter, okay, so the question was, when you say families are being told, what family specifically? If you're a family looking to place somebody, you need to ask that. So you're not, you need to ask, and then the facility will tell you. With regard to so obviously the families of the person who's been tested positive are told. What about the other families there, Dr. Antone?
I know that some facilities have done that.
So, some facilities have. Becky, do you know, is it all facilities have done that? Or, oh, Becky's coming up, so apparently she's got an answer on this one, good.
The CDC recently put out a requirement for all long-term care facilities to make sure and notify families of residents. And it would include what is going on in that facility. Of course, they wouldn't identify anyone by name, but they would be able to notify any families who have residents in a facility of what is going on in that facility so that they can be reassured.
Thank you, Becky. That's why we have experts here. Good job. Again, folks, thank you very much. Appreciate everybody coming out here this afternoon to talk about what the state is doing to slow the spread of coronavirus here in Nebraska. I want to thank all the Nebraskans who are working so hard to prevent the spread of coronavirus here and the sacrifices you all have made. Please continue to remember our social distancing guidelines, all the good hygiene rules we talk about, our 6 rules. I want to thank our guest today. Becky, thank you very much for coming and filling us in on our plans for the long-term care facilities. And Chris, thank you very much for talking about the great work that the Boy Scouts are doing to be able to help our food banks out here in the Midlands here. So thank you all very much. I hope everybody has a great weekend. Enjoy some of what will hopefully be a little bit warmer weather. And we will all see you back again here next week, 2 p.m. Central Time for these press briefings, 5 p.m. On Tuesdays and Thursdays for the Spanish language briefing, and then NET 8:30 to 9:30 for Speaking of Nebraska. Thank you all very much and have a great weekend.